people of Ghana is your Nigerian get pleasure, bringing you political news in Achale and Informative. Just the name Dr. Bawumia gives the opponent palpitation, according to Laratu. Please, Reg.
I don't come and sit here and do propaganda that she is.
Yes,
in my party, we've never had a propaganda secretary before. And our propaganda, and because we don't have that, your general secretary used to be a propaganda secretary. Annie, she spoke about bank hospital.
Yeah.
And anytime we sit here, I tell you that, you see, when it comes to infrastructure, because of the time span of it, look, putting together a district hospital is an average of 14 to 18 months. A regional hospital is about 24 to 36 months. All those things, you get it. So sometimes infrastructure can span over a period, depending when it comes to even health facilities, because of the levels. Sometimes you can have a facility that started as a CHIPS, and as the community grows, they can be upgraded into a health center or a district hospital by adding on facilities. So when it comes to health, when it comes to education, social infrastructure, we need to be careful what politics we make out of it. Let me read this out to you. And she mentioned that she keeps talking about and the bank hospital and the bank hospital. Hospitals are not just infrastructure. Hospitals go beyond just the physical infrastructure. And listen to this. This is a keynote address, commissioning of Bank Hospital Limited. This is an address at the formal opening of the bank hospital by Dr. Ernest Addison, Bank of Ghana, at the forecourt. I'll leave those details. Let me give you assets of it. He said, Mr. Chairman, going into memory lane, the idea of the bank clinic was initiated in 1987 by the governor, the late Dr. Agama. Then he goes further, gives how they moved. The decision was taken to convert the bank clubhouse at number 43, 7th Avenue Extension, North Ridge, into a clinic, and went on and came. It was 2012 that the decision was taken. But that doesn't mean that idea of building. You start again. The bank's core mandate is not health.
What do
you get it? So they did. So what? When they took the idea, they started recruiting. You get it?
You mean in 1975?
From 1987.
Sorry, 1987. They started recruiting for what?
Yes, it came to the clinic, opened its doors to bank staff on 6 June 1988 with a small team consisting of a doctor, 1 nurse, 2 staff, and all that. He went into all that. You see, when it comes to health, education, and
what's
all
your
that,
point on the Ghana,
my point is
bank hospital?
My point is, when you make it seem as if the bank hospital, when did it even become operational? It was after 2017. Who was in power? It was His Excellency Nana Akufo-Addo. That's why I keep saying, when it comes to governance, and Beatrice needs to understand governance.
So that means that
governance is not propaganda.
Okay, so that means hold on. So that means free SHS is not originated from Nanado.
How do you say free SHS is not originated?
Because it's in the Constitution.
What is in the Constitution?
What do you have in the Constitution? What do you have in the Constitution? I'm asking you a question.
And do you have children in school?
After coming late.
Wait, let me line them up.
Yes, line them up.
So we have free SHS, which we would say that it's in the Constitution. Is there? Is that Constitution? Yeah.
Yes.
We have
free
digitalization.
Free compulsory basic education.
Hold on.
Free SHS is not in our Constitution.
Digitalization, right?
There is nothing to say.
That's also not
free
hold
SHS
on.
Is not
Let
in
me
our
finish. I'm just trying to give you a list.
Free SHS is not in our Constitution. Or it's in there.
So digitalization also didn't start with Dr. Bawumia.
Come again.
Digitalization. All the name and attributes that we're trying to give to Dr. Bawumia didn't start with him, right? Because we already had the foundation. In fact, the NDC has been saying how they laid their priority cables before this government took over.
Just as they wanted to do interoperability at 1-point-something billion, and we came and did it at 4.something billion.
We also have
we get it.
The website, the Ghana. That website, that the eServices.gov.gh. That also, you would say that you are not the one that actually brought that domain.
Maybe if you were listening to me, I said, when it comes to infrastructure.
I was listening to
No,
you.
no.
These are all infrastructure.
Annie, let me make my point. I was listening to you. See, when I said it, and you say, why are we doing comparison? I was sitting here when she was making unfounded statements about people making money and not understanding people, making statements that she can't substantiate anywhere as a lawyer. You kept quiet and we were listening to it. You're probably even adding salt and pepper. That is fine, you know. But let me tell you, you said free SHS is in our constitution.
So in effect,
free SHS is not in our constitution. It's free compulsory basic education. Because you interjected, let me deal with it. I'll come to the BOG point. Free compulsory basic education. What is defined as basic education in this country? I asked you, you have children in school. I sit here and I wouldn't lie. My children are not in a public basic school. Why? Because of the state we have our basic schools. But you have people take their children all the way to primary, kindergarten, primary, and junior high school and go to the SHS with their kids. Because we still have some level of confidence in our senior high school system. But when you come in and you make a deliberate policy to make sure that you do those things and improve on it. Look at the STEM schools that are being built. You are in Accra. If you go into the enclave of where Galaxy International School and now Rihanna, the Accra STEM Academy is being built there from kindergarten to senior high school. That is the kind of schools we all look up to take our children. So when you make deliberate policies, it's not all about infrastructure. It's not all about the infrastructure. The bank hospital was the decision to put that up. He said what? Let me go to paragraph 8.
So people make decision in 1995.
He said
1987.
guided by the
So
core
because somebody
values.
made a decision in 1987, then all of a sudden they slept and woke up in
Please
2017
Please keep quiet.
and it became operational.
Please keep quiet.
Hey, you should have come
Let me
later
give you.
than this.
Let me come you. Let me
The
give
time
you
is too
8.
much for
You
us.
get it? In 20, that was a new. This was being read by the new governor. Came in 2017. Said with the change in government in 2017, a new management was constituted for the bank. At the time of taking office in April 2017, the new management inherited 3 different bank projects at stages of completion, namely the development and construction of 60-bed hospital and a 56-bedroom guest house in Takoradi. Then people were not unemployed. People were not hungry, but they found it necessary to start a guest house.
Hospital.
Based on the work completed on the hospital project.
With the money. You're
So based on the work, I think we can give ourselves some respect.
Don't say
You
that
spoke for over
How do you
45
compare
minutes.
hospital
I wasn't here.
to people hungry? When the people are hungry
At that time, there was still unemployment. There were unemployed graduates association, but they found it necessary, in addition to a 60-bed hospital, to go and build a guest house.
Which guest house?
There is a 56-bedroom guest house in Takoradi and Tamale.
Yeah.
Not only one.
Yeah.
Not only one.
Yeah.
Two.
Say the
People
one
were
who didn't
unemployed.
headquarters.
People were hungry.
The guest
You
house.
get it? Yes, 2 guest houses.
Are they
Hospital
useful
and
today?
guest-
Are they
Well,
useful
I don't
today?
know.
Are they generating
No,
revenue?
I don't know.
No, that
Based on the work.
Compared to your
Please,
headquarters.
can you please keep
No,
quiet?
your analysis
Can you
must be
please get?
spot on.
Can you
because
please keep quiet?
some of your analysis
I
are
take very
it's
strong
guest house for
decision.
the
You
state.
sat down here and talked about the president not being sensitive to, because the president didn't bring a replica of Amina to come and tell us that Amina is wearing pics. So, and that's your understanding of SONA. Don't let us go there. The hospital, 60-bed hospital, this is in 2017 when it was taken over. The decision of the hospital building the hospital was taken in 2012. You get it? Tender was done in 2013. When did it become operational? After 2017. Governance is a continuum, and especially when I always say, when it comes to hospital and education, let's build on it. And that is why young people like us and younger people like Beatrice need to understand. So don't worry, you guys start at Laribanga when people are gotten an Islamic school. You guys start at the mosque and think you see it.
Do you think the cathedral was a point that the president should have mentioned in the State of the Nation? The cathedral, yes.
Hasn't it over?
Do you think he should have mentioned?
Hasn't it been overflowed?
How?
They said, hold on it.
So it is something that the president should have mentioned, because
that is what
firstly,
is important to you.
Firstly, no, you won't say that.
Yes,
firstly, it wasn't a project that we budgeted for. And eventually, we used our money into that project. So if it has been abandoned or it had been put on hold or whatever it is.
Was it in the 2024 budget?
Exactly my
point.
Was
the cathedral in the budget?
Exactly my point. I'm saying that
was it
if
in the
it was
budget?
not in the has been abandoned or it had been put on hold or whatever it is.
Was it in the 2024 budget?
Exactly my point.
Was the cathedral in the budget?
Exactly my point. I'm saying that
was it
if
in the
it was
budget?
not in the budget and you still use our money to do it, it means that you should give us updates on that.
So when we are talking about things happening in the country now, in the perspective of government, is the cathedral one of the things happening now?
So why did we use money if it was not in the perspective of government? Why did we use money
in the 2023 budget? The money that was even allocated for it ended up in communication and roads. Some allocation that was made for it. Right? So whatever the state, the president is talking about is things that are happening. Is the cathedral one of the things happening now, currently active in this country?
Should the government put its hand in the public purse and allocate funds to any project it wishes or it permits itself, and it's quote unquote waste money like that because it is not in the central collection of things that maybe the economy is focused on? It can decide not to talk about it and just go scot-free and just let it go. Is that what you're saying?
I think you're missing the context.
That is the point you're making.
That is not the point I'm making. That is your understanding of the point I'm making. The president went in this State of the Nation. It's not like a president who waits at the end of his 4-year term and comes to talk to us about issues happening and what he's doing as the father of the nation. It's done yearly, or should I say annually. Right. It was done in 2017, it was done in 2018, 2019, 2020, 2021, 2022, 2023. Right. It's been done in 2024. There are issues that are pertinent and active there.
Please do well to like, comment, follow, put your notification bell so you get all our updates one by one. Thanks, my people.